Hi, my name is Dr. Jeffrey Weiss. This is another episode of Medicine Confidential. Today we will speak about the FDA. For interest's sake, I went online and I published and printed up all these criticisms of the FDA. Overregulation, underregulation. It's essentially they can't win. Um, the biggest problem now, though, is cutting of staff, so everything takes longer, having less experts to review the applications. Because at the end of the day, these are people reviewing applications. They're not gods. They don't know what's going to happen in the future. They can only do the best they can. But human nature has not changed, and there's always going to be bias and greed. And I think politicians should stay away from this. But that's not going to change because always people want advantage and they get paid off. And people leave the FDA to get drug company jobs where they make a lot more money. I mean, this is human nature, but we should try to minimize these effects. I can tell you about my experience with the FDA. 30 years ago, I applied for a 510K to allow me to sell a needle that I had invented that could cannulate a retinal blood vessel. This was the size of a human hair, and I was able to perform surgery for stroke in the retina successfully using this needle. And the whole process cost me less than $10 just in postage. The examiner was nice. He said, "You're treating an unmet need because there was no other treatment at the time." And I got the 510K promptly. That was a very good experience. 10 years later, I tried to get a 510K for this. Now, this is a commercial ophthalmoscope, and this is a Microsoft webcam. What I did was attach them, and I could take photographs of the retina, but portably using a battery. At the time, these fundus cameras, these big machines in people's offices, could cost $15,000. And this device was only a few $1,000s. So doctors starting out, doctors who had multiple offices, doctors who went to the hospital, the bedside, or to nursing homes, could all take pictures. And in fact, one optometrist who didn't have a lot of money bought this camera and sent me some photographs of a 22-year-old woman. And I said she needed to have a CAT scan based upon what I saw in the retina. I'm a retinal specialist. Turned out she had a grapefruit-sized brain tumor. She was operated on and she did well. So this little thing saved this woman's life. Now, when I applied to the FDA, the examiner started off by saying, "I'm not used to dealing with people like you." What do you mean? I deal with big companies. And then she went on about there was a conference coming up and she needed money to go attend. Well, I let that pass. And she sent me 800 pages of FDA regulations about this. And long and short, she wanted the source code from Microsoft. Now, my point was each one of these devices is commercially available right now. All I did was put it together, and it just takes a photograph. It doesn't interpret the photograph. The doctor has to still do that. And I compared it to the other photographs, and they were excellent. In fact, at one time, the U.S. military was interested in this for battlefield use. But she sent me 800 pages of stuff. I hired a lawyer, $30,000, complete waste of money, because he got nowhere as well, because she wouldn't approve it. And so it was never approved. And so this little simple thing that wouldn't cost much was never approved. Now, in all fairness, in the last 2 years, I've submitted a breakthrough designation for the Alzheimer's device that I invented, that I spoke to you about in prior episodes of Medicine Confidential. And the examiner got back to me promptly and was excellent. We had an excellent conversation. I explained to you that I've done a small study, and the FDA wants more patients, a larger study. And that's what I intend to do. I have 3 commercial grade units being manufactured now, and we will be doing testing. So he was very reasonable. You know, when you hear about a research study, you have to understand, because I have patients saying, oh, look, there's a research study. Well, there's a phase 1, phase 2, and phase 3. If you look on the NIH website, clinicaltrials.gov, they list roughly 500,000 studies from all around the world. Phase 1 study is just safety, to make sure that the drug is not going to hurt you. So when a patient thinks, oh boy, they can do a study for me, they just, if it's a phase 1, they just want to see if the drug is going to hurt you. Phase 2 is a small study to see if it has efficacy. Phase 3 is the large one, with a lot of patients, to see if it works. Unfortunately, my majority of drugs fail this. That's why drug development can cost up to $1 billion and take 10 to 15 years. And we do that in this country, and essentially other countries benefit from all the money we spend for the FDA to approve the drug here, and then they go along with it. So that's one reason drug prices are so expensive. The other one, major one, is they can charge what they want. Once a drug is FDA approved, they can charge anything they want. There's a particular eye treatment that I was treating and charging roughly $16,000. A company developed another treatment, and you know what they're charging? They got their drug FDA approved. $415,000 per eye. And you know what's funny? The results of my $16,000 procedure using your bone marrow derived stem cells, so there's no drug, is better than theirs. But this is the way the game is played here in this country. So I hope you got some benefit out of this. See you next time. Have a nice day. Bye.